The epidermis is the most superficial layer of the skin, then deep to that the dermis, and deep to the dermis is the hypodermis. The epidermis is made of simple squamous epithelial tissue, the dermis is made of dense irregular connective tissue, and the hypodermis is made of adipose connective tissue. The layers of the epidermis are the most superficial, the stratum corneum, and then only in the thick skin there is the stratum lucidum, which is not in this picture. Then in the thick skin, what would be deep to that, but in the thin skin, what is deep to the stratum corneum is the stratum granulosum, and that is the last layer that is alive before the dead stratum corneum. And then deep to that is the stratum spinosum, and then deep to that, the final layer is the stratum basale. The youngest layer of the epidermis is the stratum basale, and the oldest is the stratum corneum. As the cells age in the stratum basale, they move all the way up the skin, going superficially, and they keratinize as they go on, making them harder and making them lose their nucleus. Once they reach the stratum corneum at the very top layer, they die and they flake off of your skin. Once cells are old enough to reach the stratum granulosum layer, they start to flatten and their nuclei and organelles disintegrate, making them die. Then they begin to keratinize to become harder so that they can flake off, and they can also protect the skin. Cells above the stratum granulosum, meaning the cells in the stratum corneum and stratum lucidum, are dead and have no nuclei. The two layers of the dermis are the papillary layer, which is made out of areolar connected tissue, and the reticulary layer, which is made out of irregular, dense connected tissue. The function of the papillae is to further give blood to the epidermis along with nutrients and to push some nerves up farther into the epidermis. The friction ridges are caused by the papillary layer in the dermis because they push up on the epidermis and they cause ridges in the skin, making fingerprints on our fingers. The first skin marking I'm going to be talking about is flexure lines, and their purpose is so that the skin does not move around, so the dermis is secured to a deeper layer in your body. As you can see by my picture there, that's what they would look like on your hand. They're little points where like the hand folds, and you can find them on your hands, wrists, fingers, soles, and toes. Then our second skin marking are striae, which are also called stretch marks more commonly. They are caused by extreme and fast growing or stretching of the skin, and they are dermal tears that are replaced by collagen scars because the area needs to be quickly repaired because it has been torn by growing so fast. One of the causes for skin color is melanin. Its production is stimulated by sun exposure, and it protects from UV/sun damage, and it's found very in the deepest layer of the epidermis. Keratin and hemoglobin are two other things responsible for skin color. Keratin is found in the stratum corneum in the hypodermis. It's responsible for the yellow/orange pigment in the skin. It can be converted to vitamin A, which is helpful for your eye health, your vision, and your epidermal health. And hemoglobin is found in the red blood cells of the dermis, and it makes the fair skin pink. It makes that pigment. On the outside, skin color looks completely different, but really it's all made of melanin and just how much you have of it in your skin. This is an example of a bruise, and it is caused by clotted blood beneath the skin. Jaundice is a liver disorder that causes yellowish skin, and cyanosis is caused by low oxygen and hemoglobin, and it causes blue skin. Hair is found everywhere but the palms, soles, lips, nipples, and portions of the external genitalia. Its purpose is to sense bugs on the skin, protect the head, and filter. There are two parts of the hair, the upper shaft and then the lower root. If your hair follicle is shaped like a perfect circle, your hair will be straight. If it is flat, it will be curly, and if it is oval-like, it would be wavy. The medulla is in the very middle of the hair. Then outside of that is the cortex, and on the outer wall is the cuticle. Hair follicles are the roots that hair stays in so that it can remain in the skin and not easily get pulled out. The outer layer of the hair follicle is the peripheral connective tissue. The middle is the glassy membrane, and the inner is the epithelial roots sheath. Circled is the erector pili muscle, and it pulls on the hair to make it stand up, and it's responsible for goosebumps. Shown here is a hair bulb. The hair papilla connects and supports the hair, and the hair matrix divides and makes more. Vellus hair is fine and it is just regular body hair, and terminal hair is coarse and is found in the eyebrows and scalp. Alopecia is the thinning of the hair after the age of 40 in both sexes. The nail's purpose is to protect the tip of the finger. The nail bed holds the nail rests on it. The nail folds cover the cuticle of the nail. The lunule is the thick part of the nail to protect the cuticle and the skin under it. The nail matrix is where the nail grows from. Sweat glands are also called sudoriferous glands, and they are found everywhere but the nipples and part of the external genitalia. A type of sweat gland, an eccrine gland, is abundant on the palms, soles, and forehead. They connect to pores and they regulate your body temperature. The other type of sweat gland are apocrine glands, and they are found in the axillary and anogenital areas, and they empty into hair follicles. Sebaceous glands are all over the body. They're very widely spread, but they're not in the palms and soles. Most of them secrete into hair follicles. They're pretty much inactive until puberty, and they secrete sebum or oil. And then acne is inflammation of a gland, and there's a pimple on the surface of the skin. Some of the functions of the skin are to protect for temperature regulation and for metabolic purposes. Protection is from like the sun's UV rays and like any bacteria or like something that could infect you that could get into the skin. Those are just some of the things that it protects you from. And then temperature regulation is you can sweat like when you're working out and your body is heating up because you're moving around a lot. You sweat and you perspire in order to get some of that heat out of your body. And then when you're cold, your blood vessels constrict, and then when metabolic, your skin absorbs vitamin D from the sun, and it can use that to have healthy bones. Some of the risk factors of skin cancer are overexposure to UV radiation and frequent irritation of the skin. The types of skin cancer are basal cell carcinoma, which is domes that develop a central ulcer, and it requires surgical removal, and it can be anywhere. And then squamous cell carcinoma, which is often on the head. It looks scaly and red, and it can be treated by radiation or surgical removal. And the melanoma, which is very dangerous. It can be pretty much anywhere. It's sometimes dark in color, has a bunch of different colors that can be, and it can be treated by surgical removal and immunotherapy. The signs of melanoma can be recognized by the ABCD rule. A is for asymmetry, B is for border irregularity, C is for color, and D is for diameter. So if all of these things have a spot on your skin, then you might have melanoma. Burns can be first, second, or third degree. First involves only the epidermis, where the epidermis is damaged. Second, the epidermal and upperdermal layers of the skin are damaged, and then third, all three layers of the skin are damaged. And then the rule of nines is used to evaluate burns and estimate fluid loss.